मेरा बच्चा एक 10 साल का है, एक बेटी मेरी 5 साल की है।
क्या पढ़ रहे हो तुम?
अपना सबक कर रहे हैं।
3 साल के बाद मैं प्रेग्नेंट हुई। मुझे ज़रूरत नहीं थी, इसलिए मैंने अबॉर्शन करवाया। पहले तो जड़ी बूटी से भी बच्चा गिर जाता रहा है। चोरी से कहीं हल्दी खा ले, मीठा सोडा पानी में खौला के खा ले, दर्द से तड़पती रहें।
अनचाहा गर्भ ठहर जाता है, उसके लिए गांव में लोग सोचता था कि गर्भपात नहीं कराना चाहिए। लोग सुनेगा तो शिकायत करेगा। हम लोग भी डरते थे कि कहीं कराएंगे पकड़ा जाएंगे।
Abortion is actually very real need of women, and if it is not done in a proper way, in a safe way, it can cause a lot of mortality and morbidity in the women.
That point in time, we had an abortion law for a long time, but something was not moving, and there were a lot of asks of making abortions more accessible and safe.
IPAS really look at what has happened to abortion services since legalization and what could be done. That was the starting point. Women needing abortion do not just need a provider and the technology for offering services, but they get the abortion services in a complex ecosystem. The woman is in the center, but around her is the family, the community, public and private health system that delivers the care, and the policy and the legal environment that impacts all these. So when we call abortion ecosystem, our work, we realize, will only be successful when we address each element of the ecosystem.
The IPAS operations in the country started late 2001. It started from convincing the state governments that women should be the center, and everything which she needs for herself should be the key which should be available at the facilities.
We can't force the women to carry on the pregnancy. So under these circumstances, comprehensive abortion care came in, where we took these abortion services literally to the doorstep of the woman.
Comprehensive abortion care is about women getting quality services that is provided by our trained providers.
Our main focus to train the medical officers, MBBS doctors, because they are the only eligible cadre to do these safe abortion practices.
The first training they had trained the master trainers.
In this training, they get the theory sessions and the practical, and they are able to do the cases voluntarily under the guidance of the trainer.
Doctors as well as nurses used to come over, and they used to get proper training for 12 days.
There are some classes like abortion scenario and clinical assessment, how they assess, and counseling, that is one session, and after that post-abortion contraception.
So, you will take the bendadine potent.
The main thing of this comprehensive abortion case is the manual vacuum aspiration, the special instrument what we are using.
Valve is made up of latex. This is the two buttons.
For abortion, what we was practicing was dilatation evacuation. The basic thing was we were using the metal curette for curating the uterus.
उसमें वो खुरुच के करते थे ना, ऐसे पकड़ के निकालते थे। ये मशीन से तो एक बार में शक हो जाता, एक दो बार में।
Biggest advantage of MVA is that it is manually operated. So in places in the remote areas where there is no electricity, there also MVA can be done.
पहले डीएनसी के द्वारा गर्भपात किया जाता था। उस टाइम पेशेंट बहुत हद तक सफ़र करते थे, पेन होता था। ट्रेनर के द्वारा मुझे लाइव करके दिखाया गया, प्रोसेस करके, कि कैसे एमवीए के द्वारा गर्भपात किया जाता है।
Okay, so after this you are going to take these instruments and wash it in the clean water.
MVA was brought into the country by IPAS. It was not like on the major forefront of the government, and hence gradually this got accepted in the public health system.
In 2002, medication abortion was approved for use in India. So suddenly we had two very simple basic technologies, MVA and simultaneously medication abortion. And anyone who worked with abortion, particularly IPAS, realized was that medication abortion was the way forward if you wanted to reach women.
We also realized that awareness is a big challenge. You may have a provider who's ready to provide services, but if women do not know safe abortion is available here, or if safe abortion is legal, they will fail to use the service.
Asha workers, Anganwadi workers, all are trained to give awareness to the public because they are the basic field care staff. So that has helped in training them so that they are going to bridge between the health facility and the community.
গৰ্ভপাতৰ বিষয়ে আমাৰ আইপাছ বাইদেউসকলে আহি আমাৰ লগত ট্ৰেইনিং দিয়ে আৰু মিটিঙো পাতে। আমাৰ গাঁৱৰ বোৱাৰী হওক বা ছোৱালী হওক তেওঁলোকৰ লগত লৈ পেলাই মিটিং কৰোঁ আমি। তেওঁলোকে মানে গৰ্ভপাতৰ বিষয়ে সবকে মানে বুজায়।
हम लोग समझते थे कि गर्भपात कानूनन जुर्म है। जब ट्रेनिंग पीएससी में मिला था तो बताया गया था कि गर्भपात क्यों कराना चाहिए और किस कारण से कराना चाहिए।
जब आईपास का ट्रेनिंग मिल गया तो हम लोग भी माने खुला बात कर सकते हैं महिला से।
4-5 महीने बाद तक अभी हमारे 2-3 महीने से नहीं है, ठीक है। जब सर्वे करने जाते हैं बताती है महिला लोग कि हम दीदी 1 महीना या 2 महीना या 3 महीना का गर्भवती हूँ, तो वो बोलती है कि नहीं हमको नहीं रखना है, नहीं चाहिए।
ঠিক আছে, যদি গৰ্ভপাত কৰাব বিচাৰিছা যিমান সোনকালে পাৰা মোৰ লগত ওলাবা, মই তোমালোকক ডক্টৰৰ ওচৰত লৈ যাম, সুন্দৰভাৱে গৰ্ভপাত কৰাই লৈ আহিম।
हॉस्पिटल गई, तुरंत उन्होंने मेरा नाम लिखा पहले, फिर पूछा मेरे से, फिर चेकअप किया।
आशा বাইদেউ লৈ কাৰণে ফাৰ্ষ্টত চিভিলত গৈ কাৰণে তেতিয়া ডক্টৰৰ ওচৰত লৈ কাৰণে গৈ কাৰণে তেতিয়া ৰুমত লৈ গৈছে আমাক। যেতিয়া মই ৱাশ কৰাইছোঁ তেতিয়া মোৰ কোনো অসুবিধা নাছিলে, ব্লিডিঙো যোৱা নাই, বিষো নাছিলে।
उसने ऐसा कर दिया कि मुझे पता ही नहीं चला, थोड़ा सा बस दर्द हुआ बस, उसके बाद मुझे बहुत आराम लगा।
पहले भर्ती भी करना पड़ता था ब्लीडिंग चेक करने के लिए, अब तो तुरंत आती करवाएंगी, 1-2 घंटे के बाद चली जाती करवा करके। अबॉर्शन के बाद उनको ये दे देते हैं कि इसको पढ़ लेना, कोई प्रॉब्लम होगी तो हमको बताना फिर आ करके। पहले काउंसलिंग नहीं करते थे, ट्रेनिंग के बाद काउंसलिंग अलग करने लगे, अलग रूम में बुला के।
It is not just abortion care, but it also counsels a person not to go for an unwanted pregnancy so that the further abortions would be avoided.
Actually, before the training, we didn't handle any such cases. We used to send the cases to the higher institutions.
ट्रेनिंग लेने के बाद में वही महिला यदि हमारे पास में आई हैं इस तरह से, तो उनको हमने बाकायदे सुविधा दी है। और उस समय ये लग रहा था कि हाँ पहले इतनी परेशानी जाती थी और अब हम उनको ये सुविधाएं दे पा रहे हैं।
IDF visit the centers and they give the feedback. How they are performing, are they are performing normally, are any difficulties is there.
IDF really they are facilitating regarding the logistics, and they have provided consultants at the state level also and even at the divisional level also they have provided consultants so that they will coordinate with the state, district nodal officers for the CAC services.
For abortion services, IDF has been our partner for quite some time, especially for developing various technical guidelines, so that technical assistance we get from them.
Bihar, the Yukti Yojana program was born. It's a public-private partnership of accrediting private facilities to provide abortion services but free of cost.
इस प्रोग्राम से ये बेनिफिट हुआ कि कोई पेशेंट जो है इकोनॉमिकल पर्पस से सफ़र होती थी तो उन लोग को हम लोगों ने फ्री सर्विस दिया.
Through Yukti Yojana, you can say that we have already established 107 accredited facilities all over Bihar, and 1,55,000 women have already taken this advantage of this facility.
With IDF, we've seen an evolution in IDF's own approaches, in its own thinking, in its own innovations that they have brought to the field. And that is really crucial because as an organization that really leads the field in India, I think it occupies a place, pride of place with respect to a partnership with government.
Our partnership with 11 state governments has led to the creation of 100 plus CAC training centers within the public health system, which during these years have led to about 12,000 providers, most of them new providers, first-time abortion providers, and they in turn have gone on to offer services to 2 million women.
Comprehensive abortion services and IPAS for us are like synonymous, because whatever policy we developed at Government of India level, when it comes to implementation, when giving trainings to service provider, partnering with the state governments and seeing the implementation happening in the states along with capacity building and also logistics and essentials being in place, IPAS has played a very important role.
We work together. IPAS is a foundation. They are with us. They work as a partner. So our policies are implemented both by NHM and also IPAS.
It's not going to stop just at the 11 states. It's going to be a widespread sort of a wave which will get all the states to get their services converted into a comprehensive care, and then it will be sustainable and will carry on its own. We don't need to be there everywhere.
ಗರ್ಭಪಾತ ಆದ ಮಹಿಳೆಯರು ಯಾವುದೇ ರೀತಿಯ ಕಂಪ್ಲೇಂಟ್ ಕೊಟ್ಟಿಲ್ಲ, ಸುರಕ್ಷಿತವಾಗಿದೆ ಅಂತ ಹೇಳ್ತಾ ಇದ್ದಾರೆ ಹೊರತು ಕಂಪ್ಲೇಂಟ್ ಯಾರು ಕೊಟ್ಟಿಲ್ಲ.
সার্ভিসটো এতিয়া আমি it becomes an affordable and approachable for all communities.
When we came into the country in 2000, the whole procedure was looked at as a pure medical procedure. We have managed to change the paradigm of the whole country actually into looking at it as a comprehensive abortion care, keeping the woman in center.
IPAS ने अच्छी शिक्षा दी, घर आकर जानकारी दी और समझाया भी। जिसको समझ में आए तो जाओ, नहीं समझ में आए तो कोई बात नहीं। हमारे समझ में आए तो हम तो आ गए।